Now you might be wondering how these conditions relate to gastric acid, so let's take a closer look at each one of these medications. First up are proton pump inhibitors, or PPIs. So for these medications, we just need to remember our Ps. Think protons, pumps, and prazols, because all of these medications end in prazol. That's going to be our omeprazole, pantoprazole, and lansoprazole. So these medications work by decreasing acid production by blocking the proton pumps or the acid pumps in the stomach lining. So do you remember when these medications should be administered? Well, that is going to be daily before breakfast. And this makes a lot of sense if we think about it, because if we're shutting down the pumps that produce gastric acid, we want to get these medications on board before clients start eating, because eating is going to stimulate gastric acid production. Now, PPIs are really great at reducing gastric acid, but remember, we said that altering gastric acid can have some downstream effects. Specifically, it's going to increase risk for C. diff and increase risk for osteoporosis and fractures. Now, you might be wondering how these two conditions relate to gastric acid, and it's actually kind of simple when we think about it. So for C. diff, we need to remember that gastric acid is part of our innate immune system. It protects us from any harmful bacteria that we might ingest, because bacteria can't survive in that really acidic environment. So if we chronically suppress gastric acid, we're going to increase our risk for gastrointestinal infections like C. diff, because it's going to have an easier time surviving in a less acidic environment. In terms of osteoporosis and fractures, it turns out that gastric acid is actually really important in our ability to absorb calcium. So if we chronically suppress gastric acid, we're going to have a hard time absorbing calcium, which is going to increase our risk for osteoporosis and fractures in the long run. This is why we always want clients to stay on the lowest dose for the shortest duration of time. And if the NCLEX asks you about education, be thinking about C. diff and osteoporosis as really important topics we need to be educating clients about.